Hey guys, it's Tony here and welcome back to my YouTube channel. So in this video, I'll be speaking about thyroid problems in women. I want to make a disclaimer that this video was not intended to diagnose thyroid related issues. All right, so to get started, so your thyroid is actually located right here, right in front of your neck. So the thyroid is a butterfly shaped gland that plays a huge part in many of your body's main function. So that includes regulating your body temperature. It helps to control your heart rate. It helps to control your metabolism as well. It also has other roles that are super important to us. So when your thyroid gland is working correctly, your body is balanced, all right? And all of your system function just how they should be functioning. But then if your thyroid stops working the way it's meant to, creating too much or too little of thyroid hormone, then it can impact your entire body. So there are actually two main hormones that are released by your thyroid gland, which are T3 and T4, just to make it easy. So if your thyroid gland is not creating enough thyroid, so there's a condition that's actually called hypothyroidism, which is a common condition where your thyroid gland doesn't create or release enough thyroid hormone into your bloodstream. It makes your metabolism pretty much to slow down. It can make you really tired. You gain weight. You're sensitive to cold. Some people get constipated, have super dry skin, and many other symptoms. So what are some of the causes of hypothyroidism? Some of the causes are due to surgery, drugs, radiation, and lack of iodine. This is how hypothyroidism is diagnosed. So you go to your doctor's going to do a physical examination, take your medical history, take some blood sample to check your hormone levels, and do an ultrasound or a scan. What is the treatment of hypothyroidism? So because you lack thyroid hormone, then the treatment for hypothyroidism, it would be to replace that missing thyroid. So a medication that's called Synthroid or Letrox is prescribed. Hypothyroidism, it cannot be cured, but almost in every patient with hypothyroidism, it can be completely controlled. So that was hypothyroidism. Now versus hyperthyroidism, all right? So which occurs when your thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism can actually accelerate your body's metabolism, all right? So it causes unintentional weight loss. Even when your appetite and food intakes remains the same or increases, you're still gonna lose weight. Some people tend to have rapid heartbeat. Some people tend to be really nervous. They have anxiety. They're really irritable. Some people have tremor. Some people have changes in menstrual patterns, increase sensitivity to heat, and enlarged thyroid glands. So your gland right here, it tends to enlarge. Some people feel super tired and have muscle weakness. They have difficulty sleeping. Their hair is really fine and brittle. Here are some of the causes of hyperthyroidism. Taking in too much iodine, immune diseases such as Graves' disease, and as well as cancers. Here's how hyperthyroidism is diagnosed. The diagnosis is fairly similar to a hypothyroidism diagnosis. Here are some of the treatments for hyperthyroidism. Antithyroid medications and beta blockers may be prescribed, radioactive iodine will be done, and a surgery called thyroidectomy is done as well. Now, how does thyroid disorder affect a woman's health? So the function of the thyroid gland has a lot to do with a woman's reproductive system, particularly if the thyroid is overreactive or underreactive. So this imbalance in hormone levels may have following effects on the woman's body. So now following the life stages, the effect on puberty and menstruation. So the thyroid disorders can cause puberty and menstruation to occur really early or super late. In addition to that, abnormally high or low levels of thyroid hormone can cause very light or very heavy periods, all right? So very irregular menstrual periods or absent menstrual period. Now, the effect on the reproductive system when it comes to reproduction, an overreactive or underreactive thyroid may actually prevent ovulation from occurring at all. So, in addition to that, the ovaries are an increased risk for cyst development if the woman has underreactive thyroid, so hypothyroidism. Severe hypothyroidism can actually cause milk production in the breast while preventing ovulation. What about its effect on pregnancy and postpartum? Thyroid disorders during pregnancy can harm the fetus, all right? So a deficiency of the thyroid hormone can cause miscarriage, preterm delivery, stillbirth, and postpartum hemorrhage. Women with overreactive thyroid during pregnancy are at risk for having more severe morning sickness. What about the effect of thyroid hormones on menopause? So thyroid disorders may cause the early onset of menopause before the age of 40 or around early 40s. Some symptoms of overreactive thyroid, so hyperthyroidism, may also be mistaken for early menopause. And these include lack of menstruation, hot flashes, inability to sleep, mood swings, and stuff like that. So treating hyperthyroidism can sometimes ease the symptoms of early menopause or prevent early menopause from happening. So ladies, please pay attention to your body. And if you have some of the mentioned signs and symptoms, then I will suggest that you go ahead and just have a conversation with your doctor. But keep in mind that just because you have these mentioned signs and symptoms, it doesn't necessarily mean that you have thyroid related problems. All right. So once again, just consult with your doctor just to get you checked up. See if you can talk to them about checking your thyroid blood levels at least once a year. So just to kind of keep track of it, because as we get older, our chances of having hypo or hyperthyroidism actually increases. All right, guys, so that's it for today. I hope you enjoyed the video, and I'll see you guys next week. Bye.